Hey everyone, and welcome to another deep dive. Today we're tackling a topic that's, it's close to a lot of people's hearts, especially here in Singapore. We're talking IVF and that whole world of pre-implantation genetic screening, PGS.
Yeah, it's a big one for sure, and definitely a lot to unpack, both scientifically and emotionally.
No kidding. It's one of those things where, everyone's got an opinion.
Yeah.
And it can be hard to sort through it all, especially when you're trying to make such a personal decision. So we're diving into a really interesting article from today written by Dr. Alexis Hang-Boon Chen. He's a biomedical ethics expert. But here's the thing. He's also got a ton of experience with IVF right here in Singapore. So he's got that insider perspective.
Right, he's not just talking theory here.
Exactly. And his big argument is that Singapore's actually right to be cautious about PGS. Which is interesting, right? Because at first glance, it sounds like a no-brainer for some couples.
For sure, especially if you've gone through multiple rounds of IVF, or maybe you're what some people call older parents, and time feels like it's ticking away. PGS gets presented as a way to maybe, improve your chances.
Totally. Like, let's test these embryos, see which ones are the strongest, that kind of thing.
Yeah, like stacking the deck in your favor. And it's important to be clear here, we're talking about couples who don't have a specific genetic condition they know they might pass on. That's PGD, and it's a whole different story.
Right. PGS is more about trying to find the healthiest embryos in general. But here in Singapore, it's heavily restricted.
Yeah.
I read that only about 100 patients have actually used it under the Ministry of Health guidelines.
Which is a stark contrast to some other countries where it's almost routine. So clearly there are different schools of thought here.
Big time. So let's dig into Dr. Hang's argument, shall we?
Oh.
Why does he think Singapore is right to be so cautious about jumping on the PGS bandwagon?
Well, he lays out a few key reasons, and the first one might surprise some people. It's the risk.
Risk? You mean with the procedure itself?
Exactly. We're talking about taking a biopsy, right? But here's the thing. It's a biopsy from an embryo that's literally just a few days old.
Oh, wow. Yeah, that's tiny.
Exactly.
Yeah.
And anytime you're doing something that delicate, there's always going to be a risk, no matter how skilled the doctor is. And you have to remember, a lot of the studies that get used to promote PGS, they're often using the absolute best, most ideal embryos. Which isn't always the reality, right? Especially for older women who are more likely to be considering PGS in the first place. So that risk of damaging an already precious embryo, that's a big deal.
Okay, so risk to the embryo itself, that makes sense.
Yeah.
What else is Dr. Hang concerned about? What makes Singapore's cautious approach seem, justified?
Well, even beyond the procedure itself, there's another layer of concern, and that's the potential for misdiagnosis.
Right.
Because it's not as simple as just checking for the right genes, It's way more complicated than that.
More complicated. How so?
Well, you see, it's like this, you've got your embryo, right? And its genes are like, imagine a cake batter all mixed up, nice and even.
Okay, I'm visualizing the cake batter. I like it. Go on.
So with the regular embryo, all the batter's the same, yeah. But with a mosaic embryo, it's like someone threw a handful of chocolate chips in, but just in one part of the bowl.
Ah, so some parts of the embryo's genes are different from others.
Yeah.
That's what mosaic means.
Exactly. And that's where PGS gets tricky. Because when they do the test, they can only safely take a sample from the outer layer of cells at that early stage. It's like only tasting the batter from the edge of the bowl, you see.
Okay, I see where you're going with this.
Yeah.
So what if those chocolate chips, those genetic differences, they just happen to be clustered on the outside?
Exactly. And those outer layers, they often become things like the placenta, not the baby itself. So you could get a false positive. The test says there's a problem, but that little clump of different cells, it was never going to be part of the baby anyway.
Wow, that's a big deal. Especially for, older women who we were talking about. They might not have as many embryos to work with in the first place.
Exactly. And if they discard a mosaic embryo based on that misleading test result, they might be missing out on a perfectly viable pregnancy.
That's heartbreaking. It reminds me of that lawsuit in Australia against that big IVF clinic, Monash IVF.
Right, exactly. Where patients were told to discard embryos that they later found out might have been totally fine. It really highlights the real-world stakes of these decisions. And this actually leads into Dr. Hang's third point, which is that even if the test works perfectly, the benefits might be less dramatic than some people think.
Wait, so you're saying even if it's accurate, it might not even be that useful? How does that work?
Well, studies are showing that a lot of embryos with serious genetic abnormalities, they just don't implant or lead to a successful pregnancy anyway. It's like nature has its own quality control system,
So it's like PGS is being presented as this way to drastically improve your odds, but it might be solving a problem that often takes care of itself.
In a way, yes. And it's important to remember there are other options, like that NIPT testing later in pregnancy, which doesn't pose any risk to the embryo at all.
Right, right. Okay, that all makes sense, but let's be real for a sec. People are flying across the world for PGS, spending a fortune. They're obviously not doing that for nothing.
Yeah.
So what's driving that demand, even with these risks and uncertainties?
Oh, you're going through IVF, right? Which
Yeah.
is already so emotionally charged. And the desire to do everything you can to have a healthy baby, it's completely understandable. PGS gets wrapped up in this idea of control, like when so much of fertility feels out of your hands, here's a test, here's something you can do.
Oh, totally. It's like,
Yeah.
if there's something I can do, even if it's expensive or a hassle, I've got to at least look into it. And I bet for older parents especially, there's that added worry about Down syndrome and other conditions.
Right, that fear is very real. And Dr. Heng gets that. He's not dismissing that at all. But what he's concerned about is how that vulnerability, that really understandable desire to do everything you can, it can be, almost manipulated sometimes.
Manipulated.
Why?
Who the clinics?
Well, he uses that word manipulation, which sounds strong, I know. But think about it. How do some clinics present the risks of, say, Down syndrome? They might focus on how much the risk goes up with age, which makes sense, but they might not emphasize how small the actual overall risk still is.
So it's like saying your risk has tripled, which sounds terrifying until you realize it went from practically zero to, still practically zero.
Exactly. It's all about framing. And then there's the thing nobody really talks about openly here, but Dr. Heng brings it up. Sex selection.
Oh, yeah, that's right. PGS can tell you the sex of the embryo super accurately.
And while it's not officially why it's offered, you have to wonder if it's part of the reason people are going overseas for it, which opens up a whole other discussion, right? Like, is that something we're okay with as a society, that level of choosing?
It gets complicated fast. And it makes you realize this isn't just about science, it's about values too.
Absolutely. And that's where Singapore's stance is so interesting. Dr. Heng's point isn't to ban PGS outright. It's more like, let's be careful. Let's make sure that if we do offer this more widely, it's done responsibly.
So it's about protecting patients in a way, both the parents going through this and the potential kids involved.
Right. And I think that's a good takeaway from our deep dive today. When it comes to IVF and PGS, there are no easy answers. It's about weighing these factors, the risks we've talked about, the potential benefits, the ethics, and making the choice that feels right for you within what's available here.
It's about being informed, really. Yeah. Just because something exists doesn't mean it's the right call for everyone, at least not yet.
Exactly. And research is still ongoing. What we know about PGS today, how accurate it is, all of that could change.
So maybe Singapore is being smart, taking it slow, gives us time to figure things out.
That's one way to look at it, for sure. Might be frustrating for some, but it could lead to a more thoughtful approach down the line.
And that's what we want, right? Informed decisions, not just jumping on the latest trend. So for anyone listening who's dealing with this right now, those IVF choices.
Don't be afraid to ask the tough questions. Just talk to your doctor, do your research. There's no one right answer for everyone.
It's your journey, your family, and we're just here to give you some things to think about. That's all for today's deep dive, everyone. Thanks for listening.